the streets in their purple speedos to raise awareness for male cancers, particularly prostate cancer, as one of the most prevalent cancers among South African men. Now, to unpack the importance of early detection, education, and community-driven support, we are joined by Andrew Oberholzer, who is the CEO of Prostate Cancer Foundation and a brave survivor who continues to inspire others through his journey of resilience and hope. This is Muzi Zulu, who is also the Gauteng Patient Affairs Board Chairman of Prostate Cancer Foundations. Together, we will unpack awareness initiatives such as the Daredevil Run and, of course, look at community foundations and essentially create a platform to bring about awareness to this particular conversation. Mr. Andrew, you are on the line. Thank you so much for joining us. Welcome to African Diaries.
Good evening, Sheila, and good evening to all of your listeners, and thank you for the opportunity to talk about prostate cancer.
Secondly, Muzi, thank you again for creating time for us this evening. Welcome to African Diaries as well.
Hi, Sheila. Thanks for having me. Thank you.
Andrew, I'll start with you. For those who may not know, in actual fact, before we get into the Daredevil Run, there was a comment that came in from TikTok that I thought should be addressed first. And Ulu was saying that one needs to be aged 40 and older to go and have their prostates checked. Is that a myth that you want to debunk and perhaps give perspective to first?
Okay, prostate cancer screening is recommended from the age of 40 for all Black African men and any man with a history of breast or prostate cancer in a first-degree relative. And then from the age of 45 for all other men. So it's not a myth. It's actually correct. And the screening that we use nowadays is just a PSA blood test. PSA is prostate-specific antigen. That's made, a protein that's made in the prostate. Normally the levels are quite low in the blood, but if there is something wrong with the prostate, so an infection or an enlarged prostate or prostate cancer, that will elevate the levels of PSA. So that's why we use the PSA screening test as a way to determine whether a man might have a prostate problem and may require further investigation. So it's not a cancer-specific test, but in terms of the ages, that's actually correct. The reason we only start screening from the age of 40 is that men younger than 40 generally don't get prostate cancer. It really affects men more and more as they get older. So the older men get, the more likely they are to get prostate cancer. But obviously, screening is really important because there's usually no symptoms in the early stages of this disease.
Absolutely. Let's then turn our attention to the Daredevil Run. I want just a full overview of what people are to expect this Friday. What is happening?
So this is just a great opportunity for men to get together. It's the biggest men's health event of the year. And we all wear the famous Hollard Daredevil Speedo. And that's just to encourage men to not be embarrassed about their bodies, not to be embarrassed about talking about sometimes what's considered a sensitive topic, prostate cancer, and also to have a little bit of fun, but at the same time to get educated about prostate and testicular cancer and the importance of screening for early detection for these diseases. So I think that combination of fun and a bit of a dare for men works very well to get them out there and active. Because if it's just purely education, we often find that kind of turns men off. But the main event is on at the Zoo Lake Sports Club at 3 o'clock on Friday afternoon. If you haven't registered, you can still do so on the field. And we encourage boys and men to get involved because boys, the most common cancer affecting youngsters sort of from 15 to about 40 years of age is testicular cancer. So it's also creating a culture of health awareness in youngsters. And then, of course, we encourage men to get involved because prostate cancer is the most common cancer that affects men. It's also the second deadliest cancer. And unfortunately, in South Africa, we have one of the highest death rates from prostate cancer. So the beauty of the Hollard Daredevil event is, apart from the fun element, it gives us a platform to talk about the importance of prostate cancer, how common it is, and particularly about the benefits of screening for early detection, because if we can catch this cancer early, it's actually really treatable.
Mr. Zulu, I want to turn to you for a second. As one who serves on the Gauteng Patient Affairs Board as the chairman of Prostate Cancer Foundation, I want to talk about these stats. Right, we are saying that the prevalence is 40 plus. We are saying that screening should fairly happen around age 40. We also want to bring some level of awareness. However, awareness serves, I think, has a better grip when you have the stats to back it up, to say this is what's happening in the context right now. Can you give us some of the stats you know?
Well, Sheila, what I can tell you is there's 1 in every 6 men in terms of the South African population, Black South Africans, 1 in every 6 will get it, which to Andrew's point is more prevalent within us. You know, whilst it is 1 in 6 in us, it's 1 in 8 in the whiter community. So all that tells you is that you've got more chances as a Black African to get the disease if you haven't screened in early than it is on different population groups within the country. Yeah.
Another question coming in here from Ulu, and Andrew, I will direct this to you, that said, I was told to do both the blood test and the finger check. Is this a necessity for both? This was counsel that was afforded to one of the individuals watching us live from TikTok.
So previously we did recommend the digital rectal examination, commonly referred to as the finger. But the research has shown it doesn't really add much benefit to detecting prostate cancer in the early stages. So for many who are not experiencing symptoms, the prostate-specific antigen test is now sufficient, and that in new guidelines, we recommend that it's just the PSA test that's necessary. Obviously, if a man comes in and he is experiencing symptoms already, then the digital rectal examination, or DRE, is essential. And if the PSA is elevated, then you will be referred on to a urologist. That's kind of like our men's health doctor. They deal with the male reproductive system and the urinary systems of both sexes. They will obviously do a full urological assessment to determine whether a biopsy is needed, because the only way to actually definitively diagnose prostate cancer is with a prostate biopsy. But we can reassure men now, and they don't have to, because a lot of them were very nervous about the finger, that it's just the PSA blood test, and that is sufficient to detect problems in the early stages. It's not 100% foolproof. I think that's just important to point out as well, that sometimes there are some rare forms of prostate cancer that actually don't elevate the PSA levels, but that's a very small percentage.
And Andrew, another question coming in, is prostate cancer hereditary, or can other factors contribute to you falling prone to having prostate cancer?
So a family history of breast or prostate cancer in a first-degree relative is a risk factor. There's definitely a genetic component, and we now have discovered that the same BRCA2 mutation that puts women at more risk for breast cancer is also an increased risk, or increases a man's risk for prostate cancer. Not as strongly as it does for breast cancer, but there's definitely a strong correlation there. The other risk factors, as I've said, is age. As men get older, they are more likely to get prostate cancer. And then, as Muzi has pointed out, race is in fact also a risk factor. So we're not sure of the reason why Black African men are at higher risk than white males. We do know that, in fact, that Black African males have get a more aggressive disease than Black American men, for example, and we think there's a genetic component there, and we're doing a lot of research around that to try and identify the specific genomes responsible for that. And that's why we recommend that all Black guys get screened at a slightly younger age than their white counterparts. We actually think that we don't have good data in South Africa, but we think that about 1 in 4 Black men, that's the case in the UK and US, are likely to get prostate cancer. So it's even a little bit more little bit worse than Muzi pointed out. But as I say, we don't have really accurate data in South Africa.
The voice there of Andrew Oberholzer, who is the CEO of Prostate Cancer Foundation. And joining him is Muzi Zulu, who's a cancer survivor, but also the Gauteng Patient Affairs Board Chairman of Prostate Cancer Foundation. Joining us this evening. If you want to send through your questions, do find us on YouTube, is where I'm going to redirect you to. Head over to YouTube, look for the page Channel Africa, and you should see that we are currently streaming live. Post your questions there. If not, +27 634 069 126 is the WhatsApp number that you can send your questions through to. I want to turn to you, Mr. Zulu, for a second. Let's talk about your story. You are a conqueror. You are proof that we need not be fearful of illnesses such as cancer, but together, but also in cognizance of where you currently stand, you are able to overcome to an extent. Share your story with us, sir.
Yeah, thanks, Sheila. And yeah, good evening to the viewers. Sheila, my story starts with early early screening, religiously trying to scan every year. I would go and do my manly tests, do everything. And that's where we started seeing that there was a constant, small as it was, but it was always going upwards in terms of the numbers. So the PSA that Andrew talks about, or the measurement that is used to detect the likelihood of you having prostate cancer is between 0 and 4, and mine was gradually increasing from 2 and approaching the 3, and I was screening every year. And then we had COVID, and then I couldn't screen. And post-COVID, it had shot up just in the space of 2 missed screenings. It jumped up, and I really needed now to go and consult with the urologist, who then did a biopsy. And at that stage, this is now in 2021, and at that time they discovered that I had a 3+3 Gleason score. And it was showing signs of being an aggressive form of cancer. So now you can imagine the shock then, Sheila, because insofar as whether I knew it was in the family, I couldn't have known, because my dad unfortunately passed on very young, and I didn't really know about that. So it was the first discovery brought about by just my being proactive and trying to just make sure that I know all my numbers. That's basically what happened in the beginning. And then I went for the first treatment, which obviously, because of the age, so there were 3 options that I could choose from. I was lucky I had age on my side, and I had a very healthy body, which meant that although it was aggressive, it gave me some options. So one could have been active surveillance, where nothing is done. We just look at it and say, well, let's just hope that it doesn't go forward, which I didn't really like, taking the risk. The other one would have been the brachytherapy. Brachytherapy is a procedure in which they insert little radiating grains into the gland itself in your body, which then, instead of damaging all the other cells next to the prostate gland, it only targets the specific areas within the prostate itself, because at the time it was still within the gland itself, so it hadn't escaped. Yeah, and then the third one would have been removing the entire prostate, which I thought, given the age, it wasn't an option for me to consider. So I went then for the brachy, which I think is the reason I'm still around and sharing my story with the people. So this was in 2021, as I say. So that brachytherapy, those cells were living within me for a year. And then at the end of 2022, we discovered that it had metastasized. So metastasized means the cat is out of the bag. So literally it was no longer within the prostate itself, but it was, it had jumped out and onto the nearby cells. So just by virtue of it being, within the pelvic area, it normally metastasizes into any of those. So it could be your lymph nodes, it could be your scrotum, it could be the bones in the area. Mine fortunately went onto the bones. And again, because of the constant screening, we were able to detect that and deal with it. That meant we had to step up the intervention. So from brachytherapy, we then had to do external beam radiation, and then couple that with a little bit of some drugs, so an ADT, which effectively what the drugs do is it suppresses the male hormone of testosterone, whereas the radiation radiates the cells that have been identified. It's 36 days of radiation that I went through, and another year of fighting the thing. Supplemented by good diet, a little bit of exercise, and tons of positivity, support of the family, friends, and just a positive attitude towards the whole thing is what I could attest to what has brought me to this day. Because a year later, we could no longer find any traces of the disease in me. So I'm 4 years, I'm approaching my 5th year actually just now in March with the disease, but I've conquered it, yeah. And conquering it, as I say, is what spurs me on in terms of spreading it. You spoke about community enlightenment and community awareness. It is exactly what drives me to try and help other guys to say early screening, has got results. Because if I had not screened early, I would have discovered it at a point where there would be very fewer chances of intervention. And that is what we try on a daily basis to help others to avoid. Yeah, let me park there,
Yeah.
Sheila, and see if there's anything else.
No, that was beautifully shared. Thank you so much, Mr. Zulu. We appreciate that,
You're
and we
welcome.
are so grateful that you are in full remission. I want to turn over to you, Andrew, and just talk about costings. I know that one of the conversations highly hosted when it comes to screenings altogether is people feel like it's out of pocket. Outside the knowledge of you understanding that you best start screening around the ages of 40, one then begins to look at the costs. Is it expensive to screen? And if so, what is the context for those that are in underserved areas?
So that's a massive challenge because within the Department of Health, they don't have policy guidelines for prostate cancer at this point, although they have been drawn up. They haven't necessarily been implemented. So a lot of men will present at their local clinic and request a PSA test and be turned away. And that's a problem because if men don't have medical aid and they don't have cover, then they probably won't be able to afford it. A PSA test is not expensive relative to tests for other cancers. It's in the region of 200 Rand in the private sector. But for men in underprivileged areas, they just might not have that. So we do try and run free PSA testing at different sites throughout the year. We one of the other beneficiaries of the Whole Lot Daredevil is cancer, and they also do extensive PSA screenings throughout South Africa. But there's not enough screening that's been done in South Africa. We are under screening, and therefore we are under diagnosing prostate cancer, and that means that we have too many men who only present when the disease is at an advanced stage. We call that metastatic prostate cancer. In other words, it's spread out of the cancer, spread out of the prostate to other parts of the body. And at that point, if we look at survival rates, if men present with advanced disease, only about 30% of them will be alive after 5 years, compared to men who present with the early stages of the disease. 98% of them, if they are treated, will be alive after 5 years. So the cost of screening is a big issue, and not having a screening policy in South Africa is an issue. It's not unique. The UK doesn't recommend screening for all men, and they're debating that fiercely now, because really, unless we are screening, because there's usually no symptoms of this disease in the early stages, screening is the only way that we can detect it in the early stages, and then ensure that men have the options. And options are not necessarily always active treatment. One of the arguments against screening extensively is that you overdiagnose and therefore overtreat men, and as a result, they have to live with the side effects of treatment. But one of the choices for men who are not diagnosed with an aggressive form of the disease is active surveillance, which means we can monitor them carefully, and if the cancer does start to spread, we can still intervene with curative treatments and still cure them, but spare them from the side effects of treatment. But it's not an easy topic that you've brought up in terms of the cost of screening, because population-based screening would be really expensive in South Africa, but it's also expensive to treat so many men who present with late-stage disease. So we do have to address this issue. There's essentially a prostate cancer tsunami that's going to hit South Africa, and by 2030 it'll be the most common cancer in South Africa.
Sure. Andrew, I think with that being said, let's address the reality of community. Do we have enough conversations within the context of South African communities to say that if there's conversation, then we understand the severity of the context, then we raise those 200 rands as communities to ensure that our men are healthy? Do we see that prevalence in terms of talk?
There's not enough awareness. A study done in the Free State, where they looked at men in a rural area diagnosed with prostate cancer, only 22% of those men had ever even heard of prostate cancer. So I think that really illustrates the points quite strongly, that there is not enough awareness. So if men are not even aware of prostate cancer, they're not going to actually present for screening. And then the second challenge there is to make sure that screening is more available. And I agree entirely with you that we need to make screening more available. It's the first step. It's embarrassing to have to sit here and tell you that South Africa is one of the countries in the world with the highest rates of men dying from the disease. And we can do better. And I think we need to work with Department of Health, with government, to put a strategy in place to do better, and to make sure that, first of all, there's more awareness around prostate cancer, and secondly, that screening is more freely available. And then we need to ensure that we're training enough healthcare professionals to actually deal with men who are diagnosed with prostate cancer, so that they can have a biopsy and then receive standard of care treatment in South Africa, and we're not doing that currently.
Yeah. And then, Mr. Zulu, as a parting shot in one sentence, what would you say to encourage men to firstly go for their screenings, and secondly to continue to converse about these things, given the context we find ourselves in?
Yeah, I guess I want to say, you owe it to yourself to know your numbers. Earlier screening gives you a greater chance of understanding where you are, and a fighting chance, a greater chance to fight and win over this disease. It's unfortunate because once you don't know the symptoms, once you don't know that you have this thing, and to Andrew's point, there are no symptoms that are showing, and you won't know until you test. So do yourself a favor. Don't be the blocker to your own success. Go get yourself checked and live happily ever after.
Absolutely.